All right, well, we are going to go ahead and get started today. I hope everyone is excited for the Halloween season. I didn't put any cute Halloween thing on this slide, but if anyone wants to share their costumes, go ahead. I am going as someone who is optimistic about the state of our government and is feeling really great about everything. So I'm going to try to embody that and put that out there and hope it comes through. But again, welcome everyone. Thank you so much for joining for our October policy forum. It has both been a whirlwind month, and it also seems like Impact Week was years ago at this point. So we do have a few things to update everyone on before we go to the next one. Megan, I have to just say I finally realized I'm of a certain age because not only do I not know what 6'7" means, I also have like no interest in finding out. I really can't do it, but I'm glad that it's going to annoy your teenager this Halloween. That's fun. And before we get into all of our policy updates, I'm going to pass it over to Jen Wisdahl, COO of FASD United and a member of the FASD United policy team for some organization updates.
I have just one real big one right now, is that we have call for abstracts open for the International Research or International Conference on FASD, specializing in adolescents and adults with FASD. So if you have access to a mailing list where people on that mailing list may be interested in submitting abstracts, if you yourself might want to submit an abstract on our website, the call for abstracts is open. And in order to have a really good conference, you have to have really good presentations. And that's where it starts, is with that call for abstracts. So, recognizing that having this FASD focused research conference in the US is a big deal. Policymakers look at it. This is an area where we can coordinate policy and practice. This does actually touch the policy space. I think right now it's more important than ever that we have really good, robust participation in it, particularly from a programic side. So if you are at all interested in putting this out to your mailing list, we'd really appreciate it. If you want to apply yourself, that's fantastic. It's on our website under the FASD conferences. And that's closing November 15th, I believe, is the last day for the call for abstracts. But don't let the date stop you. Like, we want really good data and information in there, and good programming. And so appreciate anything any of you are willing to do to push that out there. So I'll keep it short and sweet today. Rest assured, we have a lot of other things going. Look for a survey on education and FASD. We're continuing. This is the third iteration of the education and FASD survey, which we got great data on last time, and I'm sure we're going to get great data on this time too. Again, that can be used to support policy action. So keep an eye open for that, and please, once it's out, share it and share that out with your friends. So that's what I have, Chris. Thank you.
Thanks, Jen. I'm really glad you mentioned the National Education Survey. That is in its final stages of being completed and should be rolled out very, very soon. November is Special Education Awareness Month, so we are excited to get it out to the general public and into the hands of teachers for that month. Jen had mentioned that we have a deadline of the 15th for getting your call for abstracts in, and I'll make sure that we have information about that put out once we publish this recording later in the week. But I also wanted to let everyone know that we are going to do another order of the Hill Day 2025 t-shirts. We're going to have that pre-order go live on Friday, this Friday the 31st, and we're hoping that we can have all the pre-orders in by November 15th. This will allow us to get them printed here locally in DC, where we can get the best quality and make sure that we can have a turnaround so we can get them into your hands before the holidays start. So for anyone who didn't join us for Impact Week, these were some really fantastic quality shirts that actually ended up leading to some really great conversations, even some meetings. I know Sierra Rouser got to give an actual elevator pitch while in an elevator because of wearing the shirt. I was stopped multiple times. Um, and I think it's a great way to celebrate the passage of the FASD Respect Act as well. So if you have any interest in doing a pre-order on one of these shirts, we're going to have the link again go live on the 31st. That will coincide with this meeting being published and the video being put up on YouTube. If you're a larger group, an affiliate, and you want to do a larger bulk order, give us a text, give us an email, and we'll sort something out for you. And if you're a self-advocate, of course, let us know that, and we'll be able to help out there as well. Okay, for anyone who is joining us for the first time here, and even for those who are not, because it can be an incredibly interesting process, one with lots of ins and outs, especially now as the government is shut down. I want to provide a quick update on the status of the bill. So I'm sure a lot of people, almost everyone here knows that the Support Reauthorization Act, HR 2483, with the Respect Act in it, passed on September 18th, just a few days after everyone was in town here for Impact Week and Hill Day. Its formal status right now on congress.gov and its formal parliamentarian status is passed Senate. So the bill has passed both chambers. The next step is for the House clerk to present the bill to the president, and they will only do that when directed by House leadership. Once presented, the president has 10 days to vote. There are a few things that can, 10 days to sign the bill. There are a few things that can happen. The president can sign the bill within those 10 days, bill becomes law. That's fantastic. The president cannot sign the bill within those 10 days. And as long as Congress remains in session, the bill also automatically becomes law. The president can veto the bill and sends it back to both chambers where it needs a 2/3 vote to override the veto. The margins that the bill passed by show that were that to happen, the House and Senate would be able to override a veto. So not too much concern there. The only realistic thing that can stop the bill from becoming an actual law is what's called a pocket veto, and that happens when the bill is formally presented to the president. They do not sign it within 10 days, and within those 10 days, the congressional session must end. The 119th congressional session ends on January 3rd, 2027. So not in a month and a half, we're talking 2027. We've got a year and a month before that happens. So say the bill is presented to the president for some reason on January 1st, 2027, and they do not sign the bill, pocket veto would come into play there, bill would not pass. Again, I want to reiterate that we are over a year away from there. One of probably the main reason the bill has not been presented so far is because all parliamentary procedures have been halted during the government shutdown. For those who are not fully aware, the government has been shut down since October 1st. We've, I believe, reached the second longest shutdown in history, with over 700,000 furloughed workers, some working without pay, others going through the RIF process, which is called the reduction in force. Right now, the only work that Congress is focused on is reopening the government, and they can do that in a few ways. They can sign a short-term continuing resolution, which continues appropriations at the set limit as prescribed during the last appropriations process. They could do that for a certain amount of time that would allow them to then pass out all 12 appropriations bills. They could actually pass out all necessary 12 appropriations bills, but that looks incredibly unlikely, as it was not done for the entirety of last year, nor was it done for the entirety of the year before. What is looking more and more likely, and the rumors that are being passed around, is that a full year continuing resolution will be signed. What this means is that an omnibus bill would be put forward that says we are going to keep appropriations levels across all 12 appropriations committee at the same level they were at last time we signed legislation. What this means is that no new appropriations would be made for fiscal year 2026, even for those bills that have had authorization done. So essentially, that would keep funding for FASD programs and services at the same level it has been at, and would not do appropriations for the new authorizations found in the RESPECT Act. I mentioned my Halloween costume being someone who is being optimistic because I'm choosing to be extremely optimistic about this, and I think for good cause. This very strange time allows states, organizations, localities, communities to make sure that they have the infrastructure in place to capitalize on the FASD Respect Act. When I talk about infrastructure, I'm not only talking about what is required in the FASD Respect Act to get funding. So I'm not only talking about creating an FASD coordinator or a task force. Infrastructure can be all of this existing systems, agencies in place that are already working on FASD. This, again, strange time allows us a period of education and of relationship development, both with state legislators who are going to be influential in implementing the FASD Respect Act fully, but also state agencies who will have a huge interest in how the FASD Respect Act is implemented. It also lets us look a little deeper at fiscal year 2027 appropriations, but also how we can influence fiscal year 2026 appropriations, even if a continuing resolution is put in place. And I will talk about that just a little bit more in the coming slides. And right now, I just want to introduce what the topic for the entire day will be, and that is essentially how the FASD Respect Act can translate into state implementation and where state readiness comes into play. So making sure that your state is ready to do work on FASD, and making sure that you as an organization or you as an advocate are prepared to help them. Fortunately, we've already seen a few successful examples of working with the state to make sure that the FASD Respect Act can be implemented and to make sure that the infrastructure is in place. I've been really impressed so far with the Ohio FASD Steering Committee. This is a committee that's been in place for years and years. Actually, it was created by an executive order, but has been operating without funding. Very, very limited funding. They have the ability to give out about $5,000 mini grants, a few of them every year, but they have been extremely on the ball as soon as they saw that the FASD Respect Act has passed, and they have started doing interagency work. So the Department of Behavioral Health has made sure that they bring in people from education agencies, other health related agencies, and juvenile justice. I just met them yesterday, and their next goal is to make sure that they have someone from each agency directly working on FASD as part of their steering committee, so that they can direct work and make sure that FASD is fully embedded within their systems. Another example of a state already doing work in this, but coming at it from a different direction, is Tennessee. A member of the Tennessee, I'm not 100% sure if it's the state Senate or the House, reached out to the Papillon Center in Tennessee and asked them for a rundown on what implementation would look like and how they would be able to increase their capacity should they receive funds through the FASD Respect Act. In order to best and fully understand how you as an organization or you as an advocate or your state can be prepared to do business once the FASD Respect Act funds start flowing, it's a good idea to have a full understanding of the legislative intent behind the bill. And we've talked about this a little bit before, but the legislative intent behind the bill, the FASD Respect Act, it shows a rededication of Congress to FASD and prenatal substance exposure through the lens of support rather than 100% prevention, and through actual understanding of the disability. These two pillars, once they are combined together, allow for actual systemic change. And when we're talking about systemic change, we are talking about something that's durable, something that is integrated across systems and allows for collaboration and coordinations between, say, a health agency, an education agency, and juvenile justice, for an example, but also something that will outlast funding cycles. I think we should all understand that funding can be inconsistent and it can sometimes be based on the administration that is in. But if the FASD Respect Act is implemented in a way that aligns with the legislative intent, that will allow the services and programs and its overall impact to be felt, even if funding were to go away at some point. So when we're talking about the legislative intent, I put in three different pillars of intent here. And the first one is integration into existing systems. And what this is it's embedding FASD-informed services into our systems of care that already exist and into the core functions of the state. So making sure that FASD services, as opposed to having, an FASD or prenatal substance exposure agency, make sure that the ones that already exist, again, health, education, justice, all of these are not only FASD informed, but have FASD informed services as part of them. Strengthening capacity is another pillar of intent. And what that means, it's the states, communities, and tribes' actual capacity to identify individuals with FASD and then support them throughout the lifetime. So that's early diagnosis, it's sustained community supports. It's a state's ability to actually address FASD. One of the main differences between the FASD Respect Act that passed and FASD legislation of the past is that this bill allows states to go in and look at their silos of care, hopefully tear down those silos so there is more collaboration and coordination, which will then strengthen their capacity as a state to address FASD. And the third pillar is coordination, and that's coordination not only among agencies within states, but also a coordination led by the federal government. So here we have a comprehensive piece of legislation that allows both the state and federal government to have strategic plans to address FASD. Coordination between the two is incredibly important and will allow for the lasting and impacting change. So when thinking about the different programs and services that your organization, your affiliate, your agency can develop or strengthen, you're going to want to try to determine if they're working towards changing systems by making sure that FASD-informed services are embedded into existing systems, or are they growing a state's capacity to address FASD? And again, this is what will allow these programs and services to be greater than the funding cycles that are allowing them to exist. I know there's been a lot of talk about funding cycles, the flow of funds. So I really just want to take a second and lay out how we expect the money to flow, starting at authorization, which is a piece of paper essentially that says you're allowed to do these things, and here's the amount of money that we think it'll take, all the way down to money flowing to organizations. So we've already seen Congress pass authorization. That's what they did when they passed the Support Reauthorization Act with the FASD Respect Act in there. They're passing legislation that will allow for all of those programs that are in there, and they're authorizing $12.5 million a year from 2026 through 2023. The authorizing, again, that's saying we're going to let this amount of money be used for these different programs. What Congress will have to work on as soon as they're back open is appropriations. And that's actually then giving the money that they said that they're allowing to be used. So one is, hey, you're allowed to use this. Appropriations is, here it actually is. So during appropriations, the Labor HHS Appropriations Subcommittee, again, will decide how much money is actually allocated. At this point in the appropriations process, there is space for something called committee report language, requests for committee report language. So what has been done in the past and what we are doing right now is requesting that the Labor HHS appropriations committees submit report language that will outline or encourage exactly how those funds will be used. So again, it's pretty in the actual legislation, it lays out the kinds of services, the kinds of programs that should be created, the kinds of organizations and institutions that can do those, and some of the requirements that those organizations and states will need in order to apply. Report language can further direct how the funds can be used and can even prioritize things within the bill to fund first. There is current report language on FASD programs that was put out prior to the Respect Act being passed. So it does feel appropriate to request new report language. Jen and Susan and I will be making the case for this next week. They will both be here in DC, and we're going to be doing some meetings for appropriators. Again, we will be making the case for report language that will allocate funds beyond that 12.5 million per year for an additional 15 million that will allow states to begin the planning and implementation, which is a kind of a necessary first step to make sure that states can get started on this process. So again, it currently authorizes 12.5 million. We are going to be making the case for report language to be released by the Labor H Appropriations Committee that will suggest another 15 million on top of that that can be given to states to allow them to start their planning and implementation. Once money is actually appropriated, the Department of HHS then distributes that funds to agencies working on FASD. So this is when Congress takes the money, takes it out of their pockets, and puts it into the pocket of a federal agency already working on FASD. Those federal agencies will then, in their smaller offices, so we're talking CDC, HRSA, potentially other agencies, will then be able to award grants and cooperative agreements to fulfill the different sections of the bill. So again, the CDC, HRSA, tentatively other agencies will then put out notice of funding opportunities. Primarily, this is something that primarily states will be applying to in order to fulfill all of the different services and programs outlined in the bill. From there, once the states have applied and get notices that they are receiving money, funds from the FASD Respect Act, local partners, that's organizations, affiliates, universities, anyone in states actually doing the work will be able to subcontract with their states, their tribes, their localities to begin the actual work or continue the actual work. And Kathy, going back to you, 15 million. So Kathy White in the chat asked if I had said 15 million or 50. 15 million is what will be requested for that first phase of planning and implementation. I hope that answers that for you there, Kathy. So as a quick breakdown of the flow of funds have been authorized. The programs that are laid out in the FASD Respect Act have been authorized. They are allowed to happen. Next, once the government's open, the Appropriations Committee will determine how much money should actually be given for those programs. Again, 12.5 per year is authorized. More is absolutely necessary for full implementation. After it's been appropriated, it is handed over to the federal agencies responsible for the work, who will then disperse that money to states to begin the work, and states are able to subcontract with grants and other cooperative agreements to ideally affiliates, organizations with proven experience working in FASD. Before we go on to the next page where we're going to start talking about how to build the infrastructure and making sure that every state is prepared to do business, I just want to make sure that there's an understanding of the flow of funds, and take this time to answer any questions at all. I know we had a few questions in the chat. So if there's any questions, now's a good time. Liz, I see you have your hand raised, so you can feel free to chime in.
Yeah, hi. I don't know whether I'm the only one that's kind of lost in all of this, but I just have a niggling question that I'm completely baffled by, and you may have said it in passing quickly and I didn't hear it. How does this process work if the Congress has not presented this bill to the president to sign? And how it these times are very odd, I realize that, but how do the ongoing steps of this process, how is there legitimacy if those agencies are at all, trying to bend the knee to the current administration, and there's no president having signed a bill. I'm
Sure.
just trying to
Sure.
legislation. I'm just trying to understand how this is
So
working in parallel. It's just
yeah,
baffling me.
no, it's a good question. And first of all, there's nothing in the Constitution that says when a bill has to be presented to the president. Unfortunately, the bill does not need to be presented, um, according to the Constitution. I don't think we have to worry about that. We know the amount of support on both sides of the aisle that there is for the Support Act, and we've seen it even for the Respect Act in general. I know we've had a lot of unprecedented things happen over the last few years. It does seem like the bill is going to be presented to the president at some point once the government is reopened. Now, another good point that you brought up is how do we work within the system when it hasn't been signed yet? Are agencies willing to do the work ahead of time? And what we've seen is that states are absolutely willing to do the work ahead of time now. States are seeing that, hey, there is going to be this mechanism for us to legitimize the work we're doing on an FASD. How do we take advantage of that? And what we've seen is that, or what we know is that states who are working on this now and have the infrastructure in place, meet the requirements, are going to be the states most likely to be able to take advantage of the funding. Now, you mentioned a question about how to work when it seems like maybe some agencies are bending the knee or they're changing and we're not sure what their missions are. And what I can say from personal experience with different agencies is that the people who are working in these agencies, the civil servants, are unbelievable. Honestly, it's like extremely bright. Like these are the people, honestly, who I want working on these issues day in and day out. Because sure, an administration changes, but the people working within the agencies, um, are subject matter experts. So while there may be things swirling on around them, they, again, highly intelligent people who want and need the feedback from the people that this impacts. So if you have a concern about, how do we work with HRSA if we're not sure that they're going to still be a functioning agency in the next 4 years, I think that it's still incredibly important to partner with them, to educate them, and to work while they're, work within the system and the constraints we're given. But I think it's still 100% necessary. We do see things moving forward, and there is at least from states, there is an excitement to begin this work. I should also add that the federal agencies are also itching and are also excited about this. We've already been able to meet with CDC and other folks working on FASD, and they've been asking, hey, so what does this exactly mean? What's next? How can we be prepared? So I understand the apprehension, but I at this point I'm not Mike, I don't have the huge concern there, Liz, but did that answer or get close to your concerns?
Yeah, I was just trying to understand it, not, I wasn't questioning or had concerns about,
Oh,
I was just trying to understand, wrap my head around it. Yeah, thanks.
Liz, you're not alone in that. I sat with Susan yesterday for a couple of hours and we were kind of going through, because we're going to DC, we're talking about appropriations at a time when the government is shut down. They haven't passed a budget. They're talking potentially about a year-long continuing resolution. Like, what does all of this mean? So, I think there are a lot of things at play. We know, for example, that the division that we're supported in the FASD programs are supported in through the CDC is apparently moving over to AHA, which is a new agency that apparently they're putting together, but that has to be ratified by Congress first. So there's a lot of work that Congress has to do to kind of get this all going, and they have to be back in session to do that. And so what we're looking at right now is what pre-work can we do before they're back in session and everybody's running around with their hair on fire trying to make up for lost time. How can we have those conversations in advance and prime the pump? How do we make hay while the sun shines? And so, I think it's you are not alone in this can be really confusing. And I just want to validate you there because it's very different. It's not a straightforward process right now. Sorry, Tammy, you had your hand up. Oh, sorry, go
Yeah,
ahead.
well, and I just wanted to add to that, they will get back to regular order. I mean, they have to get back to regular order. And once they get back to what I mean by regular order, the House will come back. And when that happens, the bill will go up to, to the president. And my guess is that by the time it gets signed, they will either have made a decision to do a full year CR or they'll start doing the work on the appropriations. The House and Senate are pretty much, they're I know they're both Republican led, but I've been going through and reading both bills trying to figure out where we might be able to do an offset, because that's what when you go and ask for funding, you have to ask for an offset from another appropriations. And so I've been going through and reading both appropriations bills and trying to find that when we go talk to the appropriations people. And Jen's right. The president, you look at his budget requests and it got rid of FERSA, got rid of SAMHSA, but neither bill they're going according to what the previous budgets were. They're using the exact same agencies for FY26. So that's not going to happen for 26. And Jen's right. They're going to have to come to the committees with their proposal and why they think that structure is necessary. And that's not going to happen this year. It could happen next year, or it could be the following year, or it could not happen. But when you go through and you read the bills, and I do it every year, they're still funding the same things. I mean, there's some things that aren't the same, or there's some increases. And so I think Chris and Jen are right. It's going to happen. It's just it's going to be a CR, and we'll see if we can get some extra money for 26, and then the ball game starts again for 27 early in the year. So
Susan, I know Tammy has a question, but I think Sid's question is related to this in the chat. He's asking, do we have an inventory of federal funding from across agencies part of FASD that's targeted on the RESPECT Act? And I do think that's something that you were working on as yesterday. So that is something that we're going to have published here shortly, Sid.
Well, that's what, as I'm going through, I mean, there's a lot of programs where there could be FASD work done, but but it's not. There's like one example would be the Eunice Shriver, which is under the National Institute of Health, and they're part of the intercoordinating committee on FASD, and I remember them saying, oh yeah, we could do research on FASD, but we never have. And so that's an example where proactive, put a report language in, do some research on intervention, whatever, on FASD. So there's lots of opportunities, and that's the whole idea behind the Respect Act. And going, and because a lot of that funding, most of that funding goes to states, right? Or there'll be pockets that'll go to universities for doing various things that could be replicated. But but a lot of that, there's a lot of funding that goes to the states that states are going to can adapt and use for FASD informed prevention and support. And so it does take an analysis of what those are, that and each state could be, they'll get the big pots of money, but then there'll be some states that'll get other kinds of funding that was just grant oriented and it wasn't just a block grant. So so we will have at some point that inventory, but it's 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 like a puzzle. It's you got to put all the pieces together.
So I think my
Super.
question kind of goes along those lines.
Okay.
And so through, the past 20 some odd years, different parts of the federal government have gotten different allotments of money that they've allocated towards FASD research, FASD programming. Is this money specifically designed to go to states, or are we going to see this shell game of the money is going to go to the CDC because they're not going to get those other funds they used to get for FASD, because this is now going to cover that? And so kind of, I think that's maybe part of my concern is, right, are we actually going to see some of the funds that we've been able to utilize in the past to address FASD disappear because this has now been passed? And then the question is, if that's happening, how do we advocate around that?
I think that's a great question. And I think it's like the 64 million or whatever. We are at the intent behind this bill, and Chris did a great effort. We're the new sections related to building FASD state tribal capacity. So that was the intent. But you're right, there's the other authorizations where there was funding that went to different groups. We don't want that to go away. That's the 12.5 point, that's 12.5. And that was 1 million to HRSA and 12.5 to CDC. So it's looking at those and what they're trying to do, but also the intent is that funding goes to the states so we can have systemic change. Because, after 50 years of research and those pots of money going out, we really haven't moved the ball forward. I mean, a little bit, but it hasn't been systemic. It's been, there've been pilot programs that could be replicated, and that would be what states, that's why you would have those through, there's technical assistance in the one section that would allow states to learn about those programs that have already been done in various pockets around the country and be able to replicate those. So, but we don't want it to have where it's just all these pockets of money and we do good things and then the money goes away and, and then we don't make any progress. Does that make sense?
That's what I'm hoping. And so I just was curious kind of what the chatter was and where we thought this might go, because I think we've seen with the federal government reducing, right, their grant capacity, our own states are also then able to they're reducing the amount of money that are going to funds. And so if CDC has lost funding and IAEA has lost funding, then is this going to potentially go over to replace some of those funding pieces they've missed? And so I think that's that advocacy piece, that if that happens, we need to be able to be like, wait 1 second here, because this is about moving the ball forward, as you mentioned, and gaining momentum to make a difference, not just establishing the status quo.
Yeah. And those are the questions we're going to have next week with key appropriators, primarily on the Senate side, because the House is nowhere to be found right now. So it's going to be, we've got some good meetings with Senate appropriators.
And Tammy, that's exactly the case that we're laying out, is that, you know, there are all these new, you know, Congress has ratified all these new priorities in FASD, particularly the state and tribal systems piece. And they're saying, you know, because, you know, the bill says the what, and appropriation says, okay, and this is how much you have to pay for it. And that's exactly why the push this next year is going to need to be on appropriations, because and we are laying out, you know, like originally we were doing this, this, and this with this much money. Now you're asking for this, this, and this to happen. We need more money in order for that to be able to happen. And here's how we're going to pay for it. So I think, you know, spot on your question. And that's exactly the case we're laying out, because we can't afford to have the things that we're already working taken away just to cover the things that we fought for the last 5 years to get passed in the bill. That's a no-win situation. And I worked too hard on this. I think we've all worked too hard on this to have that happen. Is there a risk of it? I think, you know, there's always a risk, but I think that the legislative intent is very clear. And I think that's something that we're not going to be quiet about. I think if we weren't working on it, if we weren't raising those questions, those concerns, and we didn't have the agency buy-in to do more, we might be in a different position. But everything we've done for the last 4 or 5 years has kind of led us to this point where we've got the political will to get what we need done. It's going to take work, but I think we can do it. I'm optimistic.
Tammy, thanks for asking that question. It's a conversation we've been having, how to avoid, what's the phrase, robbing Peter to pay Paul, or something like that. How to avoid that. And a lot of it comes from proactive advocacy, making sure the need is demonstrated. Great question. So again, I have already mentioned what state infrastructure looks like, making sure that there's an understanding. That's not simply the state FASD coordinator and advisory committee that are required as part of the law. But those two are really big key pieces that you can take actionable steps towards establishing right now, whether or not the federal government is open and operating, whether or not that the Respect Act is being fully implemented right now. Now is the ideal time, in fact. So again, the Respect Act does anticipate that states will have an advisory committee and coordinator that will help direct work within the state. This coordinator and the advisory committee will help coordinate the work done across agencies. It'll help implement and create the state strategic plan, which should align with the priorities set forth in the FASD Respect Act. And they will also report on different outcomes. They can also, in the draft legislation that we put forward for you to use, the state coordinator will also have a huge role in administering the funds, so directing where the funds go within the state, what sort of programs, and will help determine who receives the funds. Again, there are 2 ways to make sure that your state is set up and has an advisory committee and a coordinator. One way is through a state statute or through state legislation. This route can be more permanent, but it can be a slower process. You have to have an understanding of the legislative calendar in your state, when bills can be introduced, and in that process. However, once it's in place, it is much harder to do away with. You can also go the route of an executive order by fostering a relationship with the executive in your state, the governor, their cabinet. This shows, top-down leadership. It shows leadership approval and can be a bit quicker than the legislative route. But in order for it to be sustainable and, enshrined in law, it will have to eventually be codified through legislation. So not only Is there an expectation for states to have the advisory committee and the coordinators for them to receive funds from the FASD Respect Act? I think that this is a real basic tenet of the legislative intent behind the bill. By having a coordinator and a committee, states are really, they have the groundwork and the ability to look at the systems that they already have, see where FASD fits in. This is a house for the FASD services to live in each state. Right now, if your state is doing work on FASD but doesn't have a coordinator, maybe the education system has no idea what's going on with the work that FASD is doing in your state, right? We need to have these in place regardless of whether or not the FASD Respect Act existed, to make sure that work is happening. Again, it really must be noted that states with these two components set up and operating will be able to move much, much more quickly once the FASD Respect Act funds flow and once notice of funding opportunities are put out. So we have, as I said, templates that are published on our website and that will be pushed out when this meeting here is published again, that set up state advisory committees and create a state coordinator. And so what do those actually do? Once you have the executive order or the statutes in place to create the coordinator and in the task force, it does the bare minimum, first of all. It meets and exceeds the minimum requirement set out in the bill that the Secretary of the HHS may require. So again, the bill says that when you apply for funding opportunities, you need a description of a committee and a description and a suggestion for who the coordinator will be. That's the bare minimum, but that really doesn't do anything for your state and it doesn't help direct the work. The templates that we've provided make sure that these other bullets here will follow. So besides just setting up the committee and designating a coordinator, the legislation or executive order will also make sure that there's interagency collaboration. So make sure that every part of your state government are communicating with each other. Break down the different silos of care, make sure that FASD can fit in, and make sure that they're all communicating with each other. The legislation and executive order will also direct the committee to start developing a strategic plan for FASD, which will guide how the funds will be used. Again, the more closely it aligns with the intent and the program set out in the FASD Respect Act, I'm sure the better opportunity to be funded is for you. It allows the committee or the coordinator to administer the funds. So again, by having this legislation or executive order in place to create the committee, to create the coordinator, you're ensuring that funds will flow in a way that can best benefit the state and FASD. And it also requires annual reporting, which will be required by the Secretary of the HHS. That allows for greater sustainability by identifying gaps and identifying how the services you've already been able to give have filled in those gaps. I've already mentioned it, Susan and Jen mentioned it, but we can talk about why this is necessary, even if we didn't have the FASD Respect Act, why states should have these advisory committees and a FASD coordinator regardless. FASD is in the states anyways, right? The work is already being done, but the work needs a home within those states. It also identifies one specific champion within the state to be working on FASD. Again, it mentioned quite a few times, but it bears repeating. It's what will allow for collaboration and coordination between systems, so they're no longer silent and not communicating with each other. But we need to have the education and health fields understanding what's happening between them. The workforce, they need to all be collaborating and coordinating together. right now, this is a huge missing piece. Many states already have an autism coordinator or substance use prevention offices, so this just makes sense regardless. With the FASD Respect Act, this means you're eligible to receive the funds, right? This opens the funding pathways. This allows states to look at the data they need on the needs and the gaps and how they will service the community. So by having this set up, not only are you eligible to receive funds, but you also have the infrastructure to start looking at, okay, here are the gaps. Here's how we already fill in some of those gaps, but here's how we can grow and build our capacity to better serve the community. Once as the committees are formed and able to look at that and look at where those gaps are, they'll be able to begin their strategic plans to embed FASD into the systems that already exist. And again, even without the funding mechanism in place, states still benefit from creating the advisory committee and coordinator. And Liz, to your point about what do we do since this hasn't even been signed yet? Again, what we're seeing is that states are more motivated now than ever to begin doing the work on it. So now that they know, hey, if we are proactive about this, if we can get ourselves set up, ready to do business, and can prove we have the ability to serve this community, there is a mechanism to receive funds. So the more that states understand that mechanism exists and how they can best serve the community, the further along everyone will be once the bill begins to be implemented. Barb Hanson.
One thing I want to add to that, Chris, is that I would hope that when states start getting involved, and and the executive can do this, but also the legislatures, not just have bureaucracy doing all of this, but have public hearings to hear from the public as to where the gaps are and what's needed. And legislatures are great for that. And when we did our task force, we had, I think, 9 public hearings around the state of Minnesota, and that's how we developed what the barriers were. Because what's going to happen is you're going to get into the discussions about eligibilities for services and why FASD, and that should be part of the plan. And the legislature and the executive have to be part of the solution. Obviously, they're not. And so if it's just a bureaucracy that's doing this, it has to be more than just that. So I think when we start this process, I think that should be really part of what states are going to be doing, because they can't do it in they just can't do it in isolation. They need to hear from those that are in the systems and those with lived and living experience.
And I see that we have 2 people with their hands up. I just want to quickly add.
I've got
Thank you, Susan.
I have to do a hard stop at 3. I've got to take Dexter for grooming. So
Thank you. Just want to know the role that affiliates can play in this part right here. You can act as convener, right? You can do your part to bring the different parties to the table. You can offer to have roundtables with different agencies to be the host and to bring different parties in to make sure that there's an understanding here of what is needed. Sid.
I think the emphasis on the coordinator and the advisory committee is obviously appropriate. That's in the legislation, but I want to echo what people have said about doing homework during this interim period when the federal message is garbled or non-existent. And I think that a key part of that, there's a reference on one of the slides to outcomes. A key part of that is if we can suggest the ways in which states and localities have begun to identify the data points that answer the question, how big is the problem? What are the plans of safe care numbers? What are the IDEA enrollments? We identified 20 different potential data points, where in many cases, if you ask the question, the response will be, we don't really collect that. That's a finding. They're not doing the job of counting those kids, parents, and adults who are in the system and who have been identified at some point. So looking for those numbers, caring enough to count, is homework that we can be doing every day right now. And some states have done it, but I don't know that we've really inventoried all the data points that are potentially available to state, local, nonprofit agencies and compiled them to answer the question, how big is the problem? The invisibility of FASD, we all know, is a part of our problem. Finding the numbers that exist or the data that they could be but aren't collecting is a part of that homework that we could be doing during this interim period.
That is a fantastic point, Sid. I'm really glad you brought it up. We have that in as an immediate step, and that is something that obviously can be done prior to the implementation of the FAC Respect Act. It needs to be, but also prior to the creation of a coordinator or a task force. There are states that should be doing this work, that already need to be doing this work. Joel, do you still have your hand up?
Yeah, along the same lines, Minnesota just recently had a task force, and I was going to suggest maybe circling back to some of those data points. They gathered some of that on our research, and it might be helpful on how that could be scaled out. So it goes hand in hand with what Susan and Sid just mentioned in terms of Minnesota's they've got the data, they just don't know what to do with it. And that's not their role in that grant that they got. But they did collect some data that was, I think, could be shared. So.
Thank you, Joel. Yeah, that'd be fantastic to share. And I think it was Madonna in the chat asked if some of those points of data we could share. Madonna, you have your hand up.
Yeah, thank you. I just want to mention we've really made impressions on our main AAP or the education system using their own data. In Maine by county, we know substance-exposed infant rates.
Oh, okay.
Oh, sorry. Among other things, even WIC utilization and the higher rate of people with intimate partner violence. Alcohol is the #1 drug of choice, unfortunately. All this stuff that's like a gold mine I have found in the last 5 years in Maine, for example, among other data points you all know, I'm sure. But it's been very effective. People are shocked at the rate of substance and alcohol use, substance-exposed infants, and other data points that are there for the picking, you know, from low-hanging fruit, if you will, and found it very, very powerful. Thanks.
Thank you. Yeah, I'm so glad that multiple people are bringing this up, because this is an area of work that can be absolutely done in the interim period. Thank you, Sid, for bringing it up initially and for agreeing to send some of those data points on to us. That's something that we can have published on our site. I know somebody had asked about a toolkit for state preparedness. We do have a suite of material coming out that will, really help make sure that states, organizations are on track. And not only that, but also the sort of support that we're able to assist in here. Along with a lot of the data that I'm sure Sid is going to send over, and there's obviously the benefit of just having that data to show the need to demonstrate gaps and everything. Another reason to collect the data, though, is to show system overlap, to show how cross-cutting FASD is, which can be difficult, of course, if they're for a number of reasons. My understanding is that data, as long as it's de-identified, can be oftentimes shared among agencies. So making sure that your state agencies are able to do that is something, as an affiliate, as an organization, as an advocate, you're able to encourage your state to do. But looking at how individuals touch multiple systems, whether it's Medicaid or PRAMS, IDEA, CAPTA, substance treatment, housing, workforce training. And if there's a connection to FASD, I think that can be some extremely powerful data to show to states on how, again, addressing FASD proactively can make a huge difference. Going through some of the immediate steps, again, stuff that we can be doing right now, things that we can do once the government is open, stuff that needs to be done before the implementation of the Respect Act fully happens. Again, ensuring that your state and that your organization is ready for business. So that means if you are a nonprofit, making sure that you have that nonprofit status, making sure that you're registered and able to work as a state contractor. But it also means working within your communities to help build a coalition of people, both with living experience, professional experience, that can educate and work with the state. And that can also involve identifying a candidate for a coordinator role. Identifying someone for that coordinator role really starts by building relationships with lead agencies and other partners within the states. So trying to have meetings, education sessions, if you're an affiliate or a larger organization, or if you're a state agency yourself, acting as the convener, bringing people to the table to begin these conversations. Individual advocates can educate on FASD, can highlight the cross-cutting impact of FASD. But this is where collaboration and coordination can really begin. Again, in order to facilitate the collection of data, this is the point where you can suggest or ask different agencies to provide, to take part in data sharing or to sign memos of understandings between agencies so that data is shared and is actually collected there. We've talked at length about the need to create the advisory and committee and coordinators. Again, we have templates for both an executive order and legislation that can bring those into being. It's also a good time to begin aligning your work, the work that you do as an organization or as an agency, with the work that is laid out in the FASD Respect Act. So making sure that the services, the programs that you are already do and will strengthen will be meeting the needs and addressing the gaps in the community. And again, as Sid mentioned, and thankfully a lot of others have mentioned, we can all be collecting data, identifying gaps in capacity. This not only will help us determine the sort of work that needs to be done, but it also helps with budget justification and just with your application in general. If you're able to show, here is the need, here's the gap, here's how we are currently working to fill that gap, here's how we could do better with some sort of actual funding. All of these steps lead or are encouraging the development of an infrastructure necessary to fully implement the FASD Respect Act, to make sure that our systems are not siloed, and to make sure that sustainable work that can outlive any sort of funding cycle, essentially. And it also promotes, but needs the promotion of interagency coordination. So making sure that the work doesn't end up siloed in one agency, and that comes from obviously through collaboration, but from education. So individual advocates offering to meet, trying to meet with state agencies, identifying a lead agency, and then making sure they understand how FASD is cross-cutting, how the work they would do on FASD will affect and impact FASD in another sector. We've gone over the 3 p.m. here, so I'm gonna stop share and invite if anyone has any questions, any thoughts. I wasn't able to keep track of the chat as we were going, so anyone who's able to stay on, wants to stay on, we can answer some questions or go deeper into any other areas you have questions on. And Kathy, yes, share line slides will be shared Friday. So the video recording of this will go up. All the slides will go out along with some of the information that Jen shared for organization updates, and a few more little pieces of info. Yeah, Liz.
This is just a quick thought for you guys to walk away with this meeting from. I understand that there's various affiliates within the United States with FASD United that are more entrenched in some states, and some where the affiliates are working on other things but not really focused in on this policy part. And then there's some that are way far ahead of other states in terms of any even grasp of what to do here. And I was thinking that it might be helpful to identify sort of the groups, the affiliates and participants, where they are in the states and sort of what bucket do they fit in. And then sort of come up with some sort of, I'm just thinking of it when a new person is elected to Congress, they come in and they have like how to do stuff and whatever, and it's much more detailed than, you know, taking up the time of everybody else. But you know, I'm in the state of Virginia, and I can imagine that there's some other folks in some other state that are sort of in the position I am. I'm having trouble getting attention and participation by other members in my state, but I don't want that to stop me from starting this process. You know, we've got a gubernatorial race going on where we think, after talking to Kate Boyce about it, we think depending on the outcome of that, we might have a way in the future. But what you just went through, I mean, for one person or two people, some direction would be helpful. For just call it the freshman class or whatever you want to call it, so that we can actually be doing something instead of just feeling completely ill-equipped to get started. Does that make sense? So just think about that.
Oh, yeah.
I think you probably know who's in good shape and who's not, or where some help is needed, but just, you know, Virginia's just a case in that. And you know, we've got an affiliate, a newer affiliate, but they're really focused on something different than this. And like all busy people, nobody's raising their hand to work on the policy stuff with me. So.
And Liz, that entirely, that totally makes sense. You know, the advocacy that needs to be done isn't one size fits all at all at this point. So we understand the need for, you know, specific direction for people at all levels, both different kinds of advocates, so organizations, individuals, professionals, but also in terms of what the organizations provide and their capacity. I think there also needs to be an understanding that I can understand that prior to the passage, there's this, oh, you know, we're not involved in policy, that sort of thing. But now that it's passed, the implementation of it really affects absolutely everybody, right? Anyone doing work on FASD has the opportunity to see their work grow and expand. And I don't see that really as policy anymore. I just see that as the work that needs to be done for FASD. But yeah, yes, to your point, absolutely, direction on an individual advocacy level. Here are the steps you can take. If your organization is at this point, has this capacity and works in this section, steps that can be taken. Just going back and taking a look at any chat questions to make sure that there was nothing missed.
I think one thing that we can do too is when we are faced with organizations that are not able to work in the policy space or feel like that's not their role to be working in the policy space, is to very gently, very kindly have a conversation about how the funding for what they do is directly impacted by advocacy. And so to the extent that they can work with you and help you and listen to you, that's going to be really important, because one of the things we have done through the passage of this bill and through the work of everybody here is shown ourselves to be a legitimate political movement. We were able to get a bill passed during an incredibly challenging Congress, right? And we've done the work of getting everything lined up. So I think that having those conversations about how, you know what, hey, I get that you can't talk to your 2 senators and your rep. However, you know, what can we do together so that we can ensure that the work you're doing can continue to be funded or expanded upon? And those conversations, at least in my experience, have gone pretty well. Again, they have to be, it can't be a, you know, well, do what I say, otherwise I'm not going to advocate for funding for you. It can't be in a threatening tone by any means, but you know, we've got some legs to stand on now too, that we are able to get things done, and working with us is in your benefit.
And Liz, to tie that to your specific case, Melissa's on the call. Melissa, you've done every form of advocacy I can possibly think of, but one thing that you've done recently is gotten in touch with the Georgia departments, right? Like you are beginning those conversations, and that's both kind of socializing them to what the intent of the bill is. It's giving them a lay of the land, and it's letting them know what is needed in order for them to benefit from the FASD Respect Act. So Liz, that's a step, a kind of a tangible step that can be taken right there. You and I, we can both reach out to the Virginia Department of Behavioral Health and just let them know, hey, this passed. Can we just give you some information on it? That start right there. You know, while it might not be the last thing you have to do, I think that that's a great start. And then the affiliate comes in, and I don't think this is a big ask of them, but they can just identify a few gaps in the state, how they're working to fill those gaps, and how the state would benefit from increased capacity to address those gaps. But yeah, again, Liz, your concerns are totally valid and totally heard. And
Yeah, and then I also just one thing to think about is that we've got adult services that is completely untouched, right? And then we've got children's services that are the focus of the affiliate. And again, I'm not trying to throw our affiliate under the bus at all. They're my friends, but I'm just trying to figure out how we sort of touch all the bases here, right? So, I mean, you know, I have a specific interest in the adult services because of the age of my children, and that's not even covered in the funding for the affiliate. So it's kind of like we need to kind of come up with a strategy on how we're going to do this. And
sure.
I just don't want more time to go by.
Yeah.
Yeah.
And this is a lot of work, this suggestion here, but I mean, you've just identified a major gap right there, right? That there's a need for services throughout the lifetime. You have the affiliate who does not have the capacity to serve adults. Maybe that's not the truth, but that's the truth that you can put out.
Well, no, it's their mission. I mean, it's completely legitimate. It's completely legitimate. I don't want to misconstrue this.
Oh no, of
I'm
course.
just talking about it as, you know, we've got way more meat to this thing than we have the pieces covered. So that's all I'm saying.
Yeah.
I can come in, Liz, quickly as the connectivity queen and say, we all know that the need is vast and enormous. And sometimes it's a matter of picking what is available and then determining how to make that grow with one goal at a time, or one, you know, sticking point at a time, which, you know, I'll hang and talk with you about that forever, Liz, and we can work more on that. And, you know, that's what we talk about in Massachusetts. It's what everybody has in mind, is how do we, there's so many things to pick out. How do we pick them all out?
I wanted to mention something, Liz, I don't know if they'll still help you or not, or maybe some of the others on the call, that when you're pretty much going through this the last 5.5 years, there was another person, Donnie Winokur, who was helpful with a group called CAPTA. And that is from the department. It's called the Citizens Review Panels, and examines the policies in the state of Georgia. Now, that is not one of the agencies like Department of Behavioral Health. It's not Department of Public Health or Department of Community Services. But getting one of these organizations involved, or finding someone in that organization, can be very helpful. So you're not going at this alone. You know, you feel you just got to find those public organizations, or it's a review panel in Georgia. But what I wanted to mention is Chris and I had reached out to several of the agencies in the state of Georgia many times. And then last January, February, had a Zoom meeting. The person who was extremely helpful, I continue to reach out, but he wasn't responding, and you're working off their portals, which is very difficult. Well, when this thing was about to pass, and, you know, we're still working it, after it passed, I sent the information, and when you're not getting a response, you're like, I got the main person. Well, the main person went to another job. They left. So you got to get a lot of different people that you can copy on it, or even if you CC them, they may not be reading it. So you go back, you look, you see where that person is, if you don't get an automated reply on that person leaving. So sometimes it's digging deeper into figuring out if someone's left that you've contacted, or finding out someone else within those organizations who can get on board. And when Chris and I Zoomed last January, February, there were quite a few people on one of our calls. So I recently sent them all, the person who took over the position of the man who was very helpful didn't seem very helpful when I sent it to her. So I went ahead a couple weeks later and sent more information about this bill passing, and I sent it to every person that we were on that Zoom call with, and then some. So that way you don't feel like you're such an island, because it can be very difficult when you're, you know, kind of doing this, you know, alone, I should say, even though you may, you know, there may be voices in the background wanting it to happen. You just keep digging in a little bit deeper to make sure you get the help that you need from possible resources that might be available. And then something happens, you know, someone may go ahead and hear your voice and decide to join with you.
Thanks for that, Melissa.
Barbara, it looks like you've got your hand up.
Yeah.
Yeah, this is going to reflect my ignorance of how this works, but is there a specific amount of money that let me back up. If our state is not ready with the state coordinator and other states are, and they can go ahead with this, will the money be exhausted?
That's a good question. Jen, if you were about to jump in, go ahead. But
Yeah, I think if your state is not ready, you just miss out at that moment. I think it's not a get on board or the bus is going to pass you by. I think that any money that we get, we're going to be advocating for and fighting for, right? And so to make the most out of that advocacy and that fight, you want the state, we want to meet that where it is, right? And so as you're looking for things to do, as you're looking for things to work on, that would be one of them. While we're waiting, you know, we kind of talked about this interim period where the government's shut down, and like these are things you kind of have to take a two-pronged approach to it. We're going to have to be fighting again for every penny that we get if we don't want that funding to stay where it is, because we can't afford to have it stay where it is. We're going to need to have more funding to get done what we as a country need done. And so the more the states buy into it, the easier case we're going to have with the federal government to go back and say, okay, the states are really buying into this. We really need this money. And the more that we're getting from the federal government, the more the states are going to buy into it, saying, oh, yeah, we got this money, or this money's coming. We need you to buy into it. So it really is, it's a two-pronged approach. It's yes and, because so much in FASD is an and conversation. It's yes and. So I would say that you might miss out on one round of funding. There might be another round of funding. You know, we can't, there's nothing written down in stone that here's how the money's going to happen. Here's exactly what agency it's going to go through. Here's the mechanism that's going to be. Here's when the grant RFP is going to come out. Here's what the questions are going to be on the grant RFP, and here's what they're going to ask for. We don't have control over that. That's all under agency control. We can do our best to influence that through advocacy. But at the end of the day, that's going to be up to the agency and up to how well we've done our job with political will in making sure that congressional intent is known. So are you going to miss out? You know, I know Alaska has a interagency task force. I know Washington State has one. I know, oh gosh, Minnesota has one.
Ohio has a group.
Ohio has one. Maryland has one. So there's a few states that have them already. Whether they're functional or not functional, you know, that's another piece of the puzzle. So I think we can only control what we can control. And our actions and our activities are going to be what's important here, as opposed to controlling the entire process, because we don't have control over it. Right? We can control our actions and our activities. But yeah, I know that's a kind of a non-answer, and I'm sorry. I wish I had a better one for you.
Well, Barb, just to clarify, there's no, and this isn't to be pessimistic, but there's no guarantee that every state receives this planning funding. They have to do the bare minimum, right? You have to do a little bit of proactive work. Essentially, the states that are further along are going to receive it faster. But this isn't a situation where you should look at it and be like, oh man, this is so much work. All these states are so far ahead. I have to do all of this stuff to get ready. The way that the legislation is written makes it a little easy for you, really. Like if you're really, really worried, like, oh man, the state's not ready for this, go to your state, give them some direction on what is needed. And that direction is simply create a description of this advisory committee, create a description of a coordinator, right? So Jen, I think what you said is exactly right. You know, you're not missing out by not being 100% ready at the start. It's one of those things where the more work you do, the better prepared you will be down the line. And Barb, on that note, I think you're the only one who's going to care. This is hyper specific. I made it to the Everson Museum and went to the cafe that you were so excited about. So I'm looking forward to talking to you about that if you're in Seattle.
Okay. So I have a follow-up question. The money seems so paltry and not very compelling. Am I correct in saying that that's a negative?
I think it's a reality. I think that, you know, I think it's funny that, you know, the day is coming where we're saying that 12.5 million is paltry. And I hear you. You are not incorrect or invalid in that statement. I think that the way it's been priced out and looked at is that these starting funds, the 15 million that we're asking for, really is to cover the salary in each state. And there, you know, we went through and calculated what an average state salary is, and here's all those things. In every state, if we were to have an FASD coordinator, what would that cost be? How could that be funded federally? Now, some of the states are already funding their state coordinators. So, you know, it's a guideline. And I think we can only go in and ask for things that we are, like, if you don't ask, you don't get. And if we were to go in and say, well, autism's getting 50 billion, we want 50 billion. You know, we're just as prevalent, if not more so, and we need that money. What we'd be asked by the appropriators is, where are you getting that money from? Who are you taking away from to get? And what makes you think you have the infrastructure built to handle that kind of money coming in? So, you know, going off of advice from numerous folks that have kind of been in the know over the years, they've suggested that we go at an incremental pace where we're ensuring that every dime is being used and every dime is being used well. Because, you know, what happened with the Center for Excellence, for example, when that came in, it was a large chunk of money, and one of the Beltway bandits saw that as a viable, feasible amount of money and came in and whoop, sucked that all up. And a lot of that money went to overhead and not to programming. And so being mindful of how the money can be spent too is really important. So no, is it like, oh my gosh, state of California, the, 250,000 we budgeted for your state coordinator and their programming, get on that, because otherwise you're really going to miss the boat. The state of California would laugh at that, right? Because that is a smaller chunk of money. But if you are already doing the work with the state of California to say, you know, hey, this is important. Hey, we've got legislation passed. Hey, we've got unmet needs. We've got data that shows that. Oh, and by the way, we can, there's the federal government is also interested in this, and there may be some funding you can take advantage of there. That's going to be important. Now, in another state, let's say we're talking Idaho, where they got nothing going on right now, for the most part. If we were to go and say, hey, we can help fund an FASD program in your state, that might be a very different value proposition, right? But the point is if we don't do the work and we don't ask for it, it's never going to get done.
So again, Jen, I'll be really quick with this, but is it appropriate to say that to the state of California, we have money that will pay for your coordinator?
We are anticipating that there will be money to pay for a coordinator based on legislation that just passed.
That's a great selling point.
That is the legislative intent.
Okay. So if we say we have money to pay for this coordinator, and then we go back and say we've got a coordinator now, then that puts us in a good position.
I think that you can say the legislative intent of this recent legislation is to have funding to cover the cost of a state coordinator.
Okay.
However, as funding rolls to state of California, we want you to be prepared for this. So, is there any funding currently through maternal child health grants? Is there any funding currently through capital legislation? Is there any funding currently through any of these other state mechanisms that might allow us to be ahead of the game by having a state coordinator in there already?
Okay.
Right? I wouldn't hinge it all on the bill, because states, whether they claim they're broke or not, they have pretty big operating budgets too, right? And hinging everything on federal funding when there's state funding available, I would, again, take it as a two-pronged effort.
Okay. Thank you.
You're welcome. Good question.
Well, we don't have any more questions or thoughts. I think we can let everyone go until our next drop in, which is next Wednesday at noon Eastern. If people are interested, that's when we get together. It's a bit like office hours. We take that time to answer any questions that people have or dive into discussions that people want to bring up. That's as opposed to this meeting, which is a bit more structured and is really led by us and is a presentation. The drop-in is a time for everyone to come in, provide their own updates or ask questions. So again, if you're interested in that, please join us every Wednesday that isn't the last Wednesday of the month at noon Eastern. Keep an eye out for this to be posted on Friday. It'll be posted on our website and on YouTube, and we'll make sure that we include all of the information on the conference that Jen mentioned, as well as our 2025 Hill Day shirt pre-order. So keep an eye out for that. Thank you so much to everyone who came today. If you have any questions in the meantime, please reach out.